Hello, doctors. This is Brian Nelson here from My Virtual Orthodontics. So I'm the guy that can do all of your Invisalign treatments for you in your practice. If you're interested in having us do that, if you go to myvirtualortho.com, all of our contact info is there. So I thought today would be pretty cool for me to show you a Clin check and how they are able, or how a Clin check is manipulated by the doctor. So this is a patient that we're working on to try and correct a pretty severe overjet. So her overjet is actually worse than this. So this bite registration was taken with her in MI, not in CR. So when she is in CR, she actually has an even more significant overjet than this. So for those of you that have never done an Invisalign case, this is the software that we use. And these little red things here, those are attachments. So that is the magic of clear aligner treatment, is using these attachments correctly. So on the lower arch we have 4, and on the upper I've got some here, and I've got some on the outside. So it looks like we've got 8 attachments totally on the top. So one of the things that you'll notice in this particular case is that if you look at the cusp tip of tooth 12, in an ideal class 1, that should be fitting back here in this embrasure between 20 and 21. And so can you see the little blue lines right here? So those little blue lines are actually little slots that are cut into the edge of the aligner, and then the patient can hook elastics right into those slots, and that's how we will get the bite correction. So in this particular case, we want to try and move all of these teeth backwards. And sometimes I can just move them back, and then other times I have to trolley them back one at a time to get them where I want to go. And then let me get rid of my IPR things. Okay, there we go. And so I didn't move this tooth, so now I will freeze that tooth, unlock that tooth, and then we can move this tooth backwards into class 1 as well. And we got that where we want it to be. Then we'll lock it again, unlock those, and then I can move all of these teeth backwards so that we've got the bite exactly where I want it to be. And then we look at things from the front. You can see we've got a midline discrepancy here. So I would be continuing to move this tooth over, then that tooth over, come on, and then that tooth over. So we've got the midlines, maybe a little overcorrected there. And then we can move this tooth over. So we've got extra space. And then I would have to go through a whole bunch of manipulations on the angulation of the front teeth so that we can eventually end up with the spaces all closed there. So that's just a short version. I don't want to sit here and do the whole thing because it's going to take a while to do that. But that is basically, instead of me sitting down bending wires chairside with patients, I sit here with my ice water and design the treatment for the patient on the computer. So it's a little less stressful because the patient's not complaining when I move their teeth really fast. So, but anyways, that's just give you a little idea on what goes on behind the scenes for designing aligners for Invisalign therapy. So hopefully you thought that was kind of cool. I think it's pretty cool. So anyways, if you would like me to do that for your patients, then check us out at myvirtualortho.com. And oh, by the way, if you think of any of your colleagues or friends that might be interested in having me do this for them, I'd love it if you would pass on our info to them. So thank you very much and have a great day. Bye.